Hey guys, and welcome back. We're going to go ahead and go through questions 11 through 15 on the November ANCC sample test. And let's go ahead and jump right back in. We got question number 11. A 70-year-old patient with a history of diabetes, hypertension, arthritis, and a new diagnosis of CAD is being discharged. The nurse practitioner teaches the patient that the first point of contact for healthcare needs is the A, cardiologist, B, endocrinologist, C, the PCP, or D, rheumatologist. Now this is a chain of command question that we had in our previous section for questions 6 through 10. The question is, who should get all the phone calls? So we are looking at this guy. Let's parse this question apart. 70-year-old guy with diabetes, hypertension, arthritis, and CAD. So came in with an MI, basically, and has a history of the typical 70-year-old guy stuff, diabetes, hypertension, arthritis. So the patient's going home, and when you send him home, you're giving him discharge instructions. If you have problems, please contact blah. Who should be their first point of contact? So we look through the list: cardiology, endocrinology, PCP, or rheumatology. So this is a fairly obvious question. Who should be the first one called? Always should be the PCP. The PCP, again, is the gateway. They saying, they try to field all the general questions. If there's something that they don't feel comfortable with, they'll say, why don't you call your cardiologist or endocrinologist or rheumatologist? But for general first point of contact, that's what we're looking for. First point is going to be the PCP, number 11. Okay, next one. Number 12, an 80-year-old gentleman has macular degeneration and is seen on a surgical unit for post-op care after a hip fracture repair. So this guy's blind, fell down, and broke his hip. To prepare the patient for discharge, the nurse practitioner should A, give illustrative pictures that instruct the patient on body alignment during activity. B, has the patient watch a video about surgeries and pre-op care for hip fractures. C, provides patient with audio tape for care of hip fractures and range of motion activities. And D, provides verbal reinforcement to the patient how to keep proper body alignment following hip surgery. Okay, so let's parse out this question again. So, older gentleman, macular degeneration, so he's blind or close to it, and he's having post-operative care. So he's already had his hip surgery for his hip fracture. We're looking for discharge. So what should we do with this guy who can't see, who had hip repair on going home? Okay, so we get rid of the obvious ones first, of course. So gives illustrative pictures that instruct the patient on body alignment. Do we want to give pictures to a blind guy? Not really, so that one is gone. Next one, have the patient watch a video about surgeries and pre-op care for hip fractures. Okay, there's two things wrong with this one. One, have him watch a video. Guy's blind. Granted he could listen to it, but still, guy's blind. About surgeries and pre-op care. Okay, this guy is post-op. He's already had a surgery. He doesn't care what we have to do before. He's had his hip replacement. So, two reasons why B is not the right answer. Let's go to C. Provides patient with audio tape for care of hip fractures and range of motion activities. Okay, see how we got audio tape versus video. Okay, that's more appropriate for a gentleman that can't see. So we'll keep that one in the back of our heads. That's a possibility. And D, provides verbal reinforcement to the patient on how to keep proper alignment following hip surgery. Okay, so C and D, so we have audio tape and verbal reinforcement. Okay, so which one do we want to do? Okay, because both are audio, audio versus verbal. Okay, the way I got this question right is I looked at the ones that were wrong. Okay, because the question's always going to try to trick you. We want to instruct the patient on discharge about body alignment. Okay, that's very important following a hip fracture, because we don't want them to flex their hip or do range of motions that isn't appropriate for someone with a hip fracture immediately post-op. So body alignment down here. Okay, so we always look for the ones that are close, but there's something in particular that's not right. So we got body alignment here, body alignment here. And remember that verbal reinforcement always trumps audio tape, because you get the communication, the back and forth communication. Am I doing this right? What should I do better? Move your leg this way or that way. You know, that gives the immediate reinforcement. You know, the mentoring aspect. So the correct answer would be D, provides verbal reinforcement onto the patient, because we're given the back and forth, it's audio, and we're looking for body alignment. Okay? This one could be it, you know, the hip fractures and range of motion, that's a possibility, but it's audio tape. So you're just throwing a tape player in the room. Hopefully they will push play and listen to it before they go home. That's not ensuring that the patient will do it. Verbal reinforcement, that back and forth, that's the key. All right, the next one. 13. When serving as a nurse researcher, the NP is guided by which ethical principle to ensure that research participants are protected from harm or exploitation? This is another one of those questions that you just have to memorize. You will get one or two of these on your examination. So let's look at the 7 ethical principles with this one right there. So these are 7 ethical principles. This is from the Barkley book. Props to Dr. Barkley. I couldn't find this listed in any other place. If Dr. Barkley has a problem with me posting this, please, Dr. Barkley, let me know and I'll take it down immediately. Anyway, key ethical principles. Non-maleficence, duty to do no harm, utilitarianism, produce the greatest good for the greatest number of people, beneficence, prevent harm and promote good, which is always in conflict with autonomy, respect to individuals' thoughts and actions. Those are always or a lot of times can be in conflict, because guy that just got in a car wreck with, you know, a gaping head wound says, I want to go home, where you know if they go home they're going to bleed out. So again, that's always going to be in conflict a lot of the time. Justice, duty to be fair, fidelity, faithful, veracity means truthfulness. Okay, so we look back at this question. What are our choices? Confidentiality. So again, we're looking at how are we protecting our research participants from harm. Confidentiality was not on this list. Again, you're going to have to memorize this list of 7. Confidentiality was not on it, so we can throw that one out. Okay. Justice, that was on our list. Non-maleficence was on our list. Right to self-determination. Okay. Is that an ethical principle? Not in of itself. That would be autonomy, I believe. But that's not an ethical principle. So that can be thrown out. So confidentiality and right to self-determination are both thrown out, because those are neither one. They can be described in ethical terms, but they're not ethical principles. So now we have justice versus non-maleficence. Okay, justice again is the duty to be fair. So is being fair protecting patients from harm or exploitation? Not really. Non-maleficence. Maleficence meaning bad, non meaning no. So no bad. We're protecting them from harm or exploitation. So the answer is non-maleficence. Now, next one, number 14. The nurse practitioner is asked to provide evidence to the hospital administration about safety of nurse practitioners placing central lines. Which resource provides the strongest level of evidence? Okay, so we have an NP journal editorial, a randomized control trial, 1, a randomized controlled trial, a systemic review, and the American Association of College of Nursing's nurse practitioner competencies. Okay. So we're looking for the strongest level of evidence. Okay. The ANCC saying that we can put in an essential line, that's A-OK. That's not giving a lot of evidence. So we can get rid of this one pretty immediately right off the bat. Now we look at the levels of strength. Okay, again, I'm going to show you something from the Barkley book. Again, Dr. Barkley, if you have a problem with me showing this, please let me know. I will erase this immediately. But we have our pyramid of significance. The lowest level of evidence is going to be an editorial or expert opinion. So that would be your ANCC core competencies. That would be your person saying an editorial, hey, we should do this. Okay. Next level up is case-controlled studies. Next one is qualitative cohort, quasi-experimental, randomized control, quantitative, and then your meta-analysis. So the randomized control trial quantitative design would be a quantitative study. A meta-analysis is multiple studies. So let's look back. So journal editorial, again, that's the lowest level of evidence. So we're going to get rid of that one. We have A1 randomized control trial. Okay, that's second highest. A systemic review. So that's looking at a lot of trials. That's a meta-analysis. So that's looking at lots of trials all at once. So this is going to be your strongest level of evidence. So the answer would be C. All right, and our last one. What procedure does the nurse practitioner perform to evaluate cytology only in the tumor? And we have excisional biopsy, incisional biopsy, fine needle, and core. Okay, so let's look at our definitions of biopsies. So there are 3 different types of biopsies, with one biopsy having 2 parts. So according to National Cancer Institute, there we go. Common types include incisional biopsies, which a sample of tissue is removed. So that means if we have a lump underneath our skin, they only have a mass underneath their skin, they just open us up, take a smidge off, and look at it under the microscope. We have an excisional biopsy. So incisional, we just open up. Excisional, we take out the whole thing, and then which we can do for like a lymph node, but we can't really do for a thyroid or a brain. Okay. And then needle biopsy is our third one. And there's 2 different types. We have wide needle, which is a core biopsy. And then we have a thin needle, which is fine needle aspiration. So we only want cytology, meaning what type of cell is it, only in the tumor. So we only want tumor cells, and we want to get just right in the middle of it. Okay, so we only want tumor. So it wouldn't be incisional biopsy, because there we're just opening up the patient, lopping off part of the tumor. It wouldn't be excisional biopsy, because we have to remove the whole tumor for that, and there's going to be some tissue surrounding it. We only want tumor cells. We don't want anything else. So then we have our needle biopsies. We have our core and we have our fine needle. Core biopsy is a large bore needle. We're probably going to get extra stuff with that, or possibly get extra stuff. The fine needle is the very small needle that we put right in the center of the goober, and we suck out some cells. That is going to be our cytology only. That's our biopsy. That's going to be the highest likelihood of only getting tumor cells. So the answer for 15 will be C. All right, guys. And that ends us. This is actually a pretty quick one. This will be the end of through question 15. We'll go ahead and continue with 16 in a little while. Thank you.